What are warts? Warts are benign, non-cancerous growths that can form on your skin and mucous membranes, such as inside your mouth. They are caused by the human papillomavirus, HPV, which has over 100 different strains, though only a few of these can lead to warts on particular areas of your body. While warts are usually harmless, they can be irritating and sometimes painful. Types of warts. Healthcare providers classify warts based on their appearance and the areas they affect. Common warts. These typically appear on the hands as rough bumps and may have small black dots. They vary in size from a pinhead to a pea. Plantar warts. Found on the soles of the feet, these warts are often flat or grow inward and can become painful when standing or walking. They can also have black dots. Mosaic warts. These small, white warts often form on the balls of the feet or under the toes. They can spread to cover larger areas and are usually less painful than plantar warts. Flat warts. Smaller and smoother than other types, these warts can appear anywhere on the body and often grow in clusters of 20 to 100. Filiform warts. These warts look like long threads and often grow on the face, particularly around the mouth, eyes, and nose. Genital warts. Affecting the genital and anal areas, these warts are sexually transmitted and appear as small, rough nodules. Butcher's warts. Found on the hands of people handling raw meat or working in cold, moist environments. Focal epithelial hyperplasia. Hex disease. A rare condition where soft, whitish warts develop inside the mouth. Are warts harmful? Warts are generally non-cancerous and harmless. However, they can become bothersome if they impact your self-esteem or interfere with daily activities, such as walking or wearing shoes. How common are warts? Warts are quite common, affecting about 10% of the global population. They are especially prevalent among school-aged children, with 10% to 20% of kids in this age group experiencing them. People with weakened immune systems and those who regularly handle raw meat, such as butchers, are also more prone to developing warts. What does a wart look like? Warts can vary greatly in appearance depending on their type. They might be dome-shaped, flat, rough, bumpy or resemble a cauliflower, smooth, thread or finger-like. Warts can also range in color, including skin-colored, brown, gray, or black, and some may have small black or brownish dots. Their size can range from as small as 1 millimeter to a few centimeters. You may have a single wart or several clustered together. While you might be able to identify a wart on your own, it's a good idea to consult a healthcare provider if you're uncertain about a new skin growth. What causes warts? Warts are caused by certain strains of the human papillomavirus, HPV. The virus enters the skin through tiny cuts, leading to extra cell growth. This results in the outer layer of the skin becoming thicker and harder, forming a wart. Warts are more likely to develop on moist, soft, or injured skin. While all warts are caused by HPV, not all HPV strains lead to warts. The types of HPV that can cause cancers, like cervical cancer, are different from those that cause warts. Are warts contagious? Yes, warts are contagious because they are caused by the human papillomavirus, HPV, which can spread from person to person. Warts can spread through direct contact, such as touching someone else's wart or skin-to-skin contact. They can also spread indirectly by using objects like towels or razors that have come into contact with a wart or the virus. How are warts diagnosed? Healthcare providers usually diagnose warts by examining the skin growths visually. In rare instances, they may perform a skin biopsy to confirm that the growth is indeed a wart. What is the treatment for warts? Warts often disappear on their own, but this can take up to 2 years. Because warts can spread, cause discomfort, or interfere with daily life, healthcare providers may recommend treatment. Options include over-the-counter, OTC, products. OTC wart removal medications like Compound WR contain salicylic acid, which dissolves warts layer by layer. These products are available in liquid, gel, and patch forms. Treatment may require daily application for several months, with cure rates between 50% and 70%. Medical topical treatments. Your healthcare provider may apply a chemical called cantharidin to the wart, causing a blister to form underneath and cutting off the wart's blood supply. The dead wart is then removed in a follow-up visit. Medical freezing, cryotherapy. In this procedure, liquid nitrogen is applied to freeze the wart, which may eventually peel off. Multiple treatments might be necessary. Other wart treatments. If conservative treatments don't work, more invasive options may be considered. Immunotherapy. This treatment boosts your immune system to fight the virus that causes warts. One method involves applying a chemical like diphencyprone, DCP, to trigger a mild allergic reaction, which may help the wart disappear. Surgical removal. The wart is cut out, but this can result in scarring. Electrosurgery. This technique burns away the wart tissue using a heated needle, with scarring as a possible side effect. Laser treatment. Laser light is used to destroy tiny blood vessels inside the wart, cutting off its blood supply and causing the wart to die. This method can also lead to scarring. How can I remove warts? There are some at-home remedies you can try to remove warts, such as covering the wart with duct tape or using over-the-counter products. However, it's important never to attempt cutting or ripping a wart off by yourself, as this can lead to infections and other complications. Surgical removal of warts should always be done by a healthcare provider. Can warts go away on their own? Yes, around 65% of warts will disappear on their own within 2 years, especially in individuals with healthy immune systems. However, if you have a weakened immune system, warts are less likely to resolve without treatment. How can I prevent warts? While there's no guaranteed way to prevent warts, you can reduce your risk of getting the virus that causes them by following these steps. Avoid touching other people's warts. Don't share personal items like towels, washcloths, clothing, nail clippers, or razors. Avoid biting your nails or picking at your cuticles. Keep your skin moisturized and protect any cuts, as HPV can easily enter through cracked or broken skin. Consider the HPV vaccine, often recommended for kids and young adults, and use condoms to prevent genital warts. Wear flip-flops or shoes in public locker rooms, pool areas, and showers. If you already have a wart, you can help prevent it from spreading by. Covering it with a bandage. Avoiding scratching, cutting, or picking at it. Washing your hands immediately after touching the wart. Avoid shaving over the wart. Keeping your feet dry to prevent the spread of plantar warts. What is the outlook for people with warts? If you have a strain of HPV that causes warts, there's no guaranteed way to prevent them from coming back. After treatment, warts may reappear either in the same spot or on a different part of your body. However, some people successfully get rid of warts and never experience them again. What are the possible complications of warts? While most warts resolve without major issues, they can sometimes lead to complications, including infection. If you pick or cut a wart, you risk developing an infection as bacteria can enter through breaks in the skin. If an infection occurs, medical treatment with antibiotics may be necessary. Pain. While most warts are painless, plantar warts can grow inward on the foot, causing discomfort when walking, similar to having a pebble under your skin. Mental health concerns. The appearance of warts can lead to feelings of embarrassment or shame, potentially affecting your self-esteem and mental health. When should I see my healthcare provider about warts? If over-the-counter treatments haven't been effective, or if the wart is impacting your daily life, it's time to consult your healthcare provider. You should also see your provider if you're unsure if the growth is a wart or it looks unusual. You have a wart on your face, genitals, rectum, or inside your mouth. You have multiple warts. The warts are painful, itchy, burning, or bleeding. You have a weakened immune system. You have diabetes and a wart on your foot. Attempting to remove it yourself could cause lasting damage. If this video was helpful, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe for more content like this. Thanks for watching.